If you were starting from scratch, how would you devise a health service for the 21st century? Would it look like the NHS? Well, to consider that, I'm joined here at King's College Hospital by Niall Dickson, who's Chief Executive of the NHS Confederation, and by Jeremy Taylor, who's Chief Executive of National Voices. It's a coalition of health charities that represent patients. And in our radio car is the Chair of the Royal College of GPs, Professor Helen Stokes-Lampard. Good morning to you all.
Good morning.
Professor Stokes-Lampard, where would you start if you were devising from scratch something that suited what we need today? What would it look like?
Well, I'd start with the patient. I'd start with the patient in their community with what they need. I'd start with a prevention agenda, a wellness agenda, and empowering patients to take control of the health agenda from their lives. Then I'd wrap primary care right round them. That first point of contact care, most people know of it as general practice, but there's so much more to first contact care than just general practice. And then from that, once you've worked what people need and where they need it, then you wrap secondary and tertiary care around that. And that way, you'd have a spread of a health system that was fair and equitable to all, that provided what was needed as opposed to what special interests wanted. And hopefully, you'd have social care at the heart of it, which would ensure patients were treated with dignity and respect from the outset.
Jeremy Taylor, that sounds like the kind of thing I imagine that you would support, that idea of the starting point.
I love Helen's starting point. We have an NHS that still operates on the principle that patients should do as they're told. And actually what we need is an NHS that acts on the evidence that patient power leads to better results. The more that patients are involved in decisions about their health and about their treatment, the better the results are. But we don't have an NHS like that, and so we really need a system that gives patients genuine power through better information, better education, and confidence to ask the right questions when they go and see a doctor. We all too often defer to the expertise of the doctor, and yet the evidence shows that doctors are inclined to make the wrong decisions if they don't fully involve patients. So actually we need to completely change the culture so that patients feel that they have a role.
Doesn't that just keep increasing demand, though?
No, it doesn't actually. It means that you get more demand for better things, and sometimes the better things are doing less. So there's quite a lot of research evidence that shows that doctors tend to overestimate the benefits of treatment and underestimate the risks. If you have a good informed conversation with your patient as a doctor, you may well end up doing less. And there's lots of evidence that suggests that the more informed patients are about the pros and cons of different treatment options, the more cautious they tend to be. So it doesn't follow that more informed, more empowered patients lead to greater demands on the NHS. Actually, probably the reverse is true.
Well, Niall Dickson, here you are sitting at the top of the confederation of the groups, the managers, I suppose, of all the different parts of the NHS. How do you see it? How would you change it?
Well, I think if you listen throughout this programme, there are really two imperatives have appeared. One is around funding and the other is around reform. So to answer your question, of course, I wouldn't start from here if I had to redesign the system. But on funding, I think it is quite clear that really the political class have not understood the scale of what is about to hit the system, that it is already under be effectively managed at home. And it's changing the way in which those services are organised so that you intervene at an earlier stage and don't have, for example, people who have got long-term conditions bouncing in and out of these institutions all the time because they're not, the investment is not going in the community.
Jeremy Taylor, Professor Helen Stokes-Lampard, thank you.
That's it. Good morning.